Shalom, Erev Tov, Boker Tov, Sarayim Tov. So it's good afternoon, good morning, good evening, and I'm so happy to be here. This is TMS RoundTable Global. We're coming on about a year, so it's exciting for us, and we just have one amazing guest after another. So I'll hand it over to my lovely co-host, Rose Huey. Hi down there.
Hi from Australia. Today, this morning, for me, we have got the beautiful Sunita Merriman, dentist, talking about sleep and the importance of sleep, the importance of uninterrupted sleep, and from a TMS perspective, peaceful sleep. Because unfortunately, when people have chronic pain, they have that sort of interruption thing happening to them all the time, often day and night. And of course, Sunita is a sleep dentist. Have I used the right words? I haven't, have I?
They're all good.
They're all good. Anyway, welcome, Sunita, and welcome, Michael. And thank you, Michael, for joining us again.
Sure.
It's so wonderful to have you around. And thank you to all our listeners and our viewers and our subscribers for being here with us and hearing how important sleep is. And hopefully Sunita's going to talk about the connection between chronic pain and early childhood trauma. Now, many of you may not have considered that arguments in the background at home, people picking on each other, they're all forms of trauma. We've got big T and small t. And Sunita is going to talk about that as well. Thank you, Sunita.
Shalom, hello, and if I may, sat sri akal. That's the Punjabi Sikh way of greeting. And I'm delighted to be here, especially so since I was one of your original early guests.
Number 4, I think.
Am I number 4?
The fourth show.
So today I'm coming from a little bit of a different perspective, actually a lot of a different perspective, but I'm bringing the same sensibilities to my topic of today. A little bit of background of myself. I've been a dentist, a general dentist, for about 25 years. And my foray into sleep medicine actually happened at the time that I was healing with ISTDP. It is personal for me, and now as I see patients coming into our sleep center in New York City, I'm beginning to see patterns. And the case that really brought to my attention a possibility of some connection between a patient's sleep disorders, their response to the treatment that we were providing them, their response to previous treatments to help them, was where I first started to make the connection. I just think that looking back, I didn't have the confidence to put it together. So a patient came in, female, about 67, 68 years old. She came in, and as many of my patients sit in the chair, you look at them, and there is no vitality. There's no excitement. Many of them are sleeping in the chair between, me asking questions. I usually encourage my patients to bring their bed partner or a family member, and that really gives me a perspective of the person who's sleeping in the bed next to them. A common complaint that I start with is snoring. So I'll say, so are you aware that you may be snoring? And the patients usually will say, I don't snore. Or even more cheeky, my snoring doesn't bother me. It's her problem. So I'm used to this. And so this patient came in, no different. Her husband was with her. And she came in with a prescription for an oral appliance from the sleep physician. And so we did all the process, fabricated an oral appliance that was suitable for her, did the whole protocol, which I'm happy to go over a little bit later so that your audience can understand what to do when you have snoring, excessive daytime sleepiness, and things like that. But we'll do that later. So I was actually quite excited to see, her on your follow-up to see what kind of changes happen, So she comes in and it's the same face. And her husband's there. He's very attentive. Some resolution of snoring. And I keep trying to pull things. I'm not trying to put words in her mouth, but any improvement, any difference? Is it getting worse? Let's deal with what the reality is. But nothing. I check your clients physically. Everything is good. And then from there on, over the next 3 months, we're getting multiple calls from this patient. There's a tooth that hurts. There's the gum hurts. I've got irritation. I forgot how to titrate it, which is the term we use to adjust the appliance, to bring it in a position that is therapeutically optimal for the patient.
You mean there was an appliance in her mouth, like a mouth guard at night?
It's an oral appliance for obstructive sleep apnea.
Oh.
So once I go over this case, I'm going to lay it out so that you really understand where does dental sleep medicine come in for your patients. And for the people, Michael, that you show in the movie, this is really exciting to put sleep, pain, psychic distress, adverse childhood experiences, how we're going to put it all together today. So yes, the appliance, it's called a mandibular advancement device. And this appliance is what holds the lower jaw forward in an advanced position so that the tongue and the apparatus behind is moved forward so the patient has more space to breathe.
Wow.
This appliance also improves the tonality of the upper airway. But going back to this patient, because it's not the clinical picture that really started to make itself known to me, but it really was how my patient was responding to the appliance and to my efforts to help her. So we got the patient in. I spoke to her general dentist. This kind of collaboration is all very usual for us. And any issues that could have been dentally were dealt with it. After maybe 3 or 4 appointments, where in reality, other patients may have been fine within 1 appointment or 2, I started to really think in my mind, should I communicate what I know to my patient? And I think this is where we are going to have to figure out how to bring ACEs or adverse child experiences in a conversation. We don't hesitate, to ask a patient, do you have hypertension? Do you have any history of cancer? Do you have an accident? That kind of trauma, anything that does with the body. Oh, fine. We go through our list. So myself, with my awareness, being an ACEs survivor, being conversant with this language, I was hesitating. And then I said, okay, there's nothing to lose. This patient and her husband are giving a history of being in the offices of 22 medical providers over the last 3 years.
And her major complaint was lack of sleep?
That was the big one, but there were many other complaints. She actually, I have her history here. She came in with hypertension, depression, mood irritability, chronic pain, and over the relationship conversations, I realized, okay, there's a major history of trauma. Her daughter had lost her husband 2 or 3 years ago. At that visit, I said to my patient, I said, do I have your permission to be very candid and speak to you like I would to my mother or an elder sister? And the key here is that I had built a relationship with them. So they said, yes, please. I said, I'm not a psychiatrist. I'm not a psychologist. However, I treat the person, and something here is not fitting. I said, your complaints of not finding relief and irritation here, your tooth hurts, I said, they're all valid. But how are you doing emotionally? And the husband actually was the one who very actively paid attention. And he said, tell me what your thoughts are. So I asked my patient, I said, how was your childhood? And she said, it was very difficult, but it's okay. I have a very good life. My husband's great. I know my daughter has had this tragedy, but that's really not where we are. So at that point, I told her, I said, I respect how you feel. My experience was very different and has been different. I said, childhood trauma, it hides within us. As you know, adverse childhood experiences impact a developing brain. A brain that is so open and receptive to imprints. It's growing. It has trillions of neurons that are connected. Let's go even further back from bases to attachment trauma. Attachment, the first imprint on our brains, and I say souls, is so important for us to feel connected to ourselves. And Michael, when I see your movie, and I recommend it to people, even if they haven't had childhood trauma,
Right.
because it shows what happens when our pain is so massive. And as a child, our brains are not allowed to develop in many ways. Cellular, immune system levels, physiology. We do not develop the ability to deal with that pain.
Mhm.
We just don't have that ability.
Right.
Other parts of us grow up. We physically grow up, and we use the parts of us that are really strong genetically. It's whether our intelligence, our creativity, and I don't want to simplify it because we all react differently to our trauma based on who we are intrinsically. But there are certain characteristics and signs and symptoms that are common across the board. And that is the exciting part of today, because so much of work is being done in schools, in early intervention, in trauma-informed education. I didn't get that.
Right.
And I had to swim. And I had to swim way harder than I needed to, because everything was about survival. And I was working with a network inside me that was full of holes. And this patient, when I started to explain to her what childhood trauma could do, her husband just, it was like a light bulb. And I said very humbly and respectfully, I said, I am not in your wife's inner world. I'm trying to connect. But 22 top of the line medical providers have not been able to help her. I really think at this point that a consultation with a psychiatrist who specializes in this, you have nothing to lose.
Right.
And so I turned the direction of their seeking care. I said, look, sleep apnea, yes, we need to treat it. Sleep is an issue. But this appliance is going to do nothing for you when your mind and your heart is so heavy.
Beautifully
And once
said.
again, once again, I'm simplifying it because today is not a course that I would teach on oral applied therapy. Today is to bring awareness of these connections and the questions we must ask as providers of care. So when I said that to the patient, I referred them, gave them a few recommendations, and I didn't hear from them. I left a message, and about a month, maybe 2 months after, I got an email from her husband. And it's so moving and so touching. She ended up getting psychiatric care, and she needed to be hospitalized. Things rose to a point where she was hospitalized for major depressive disorder. Fast forward, she did the care that she needed. And I started to delve a little deeper, and I gained the courage to be honest about my own sleep issues. And I'll stop here. If you have any questions about this case, ask me. If not, then I'm going to share my struggle with sleep and connect to ACEs, therapy, and how I came up with this article. So I'll pause for any comments. Yeah.
The one thing that comes up a lot is, even as we're talking, and being a non-professional, kind of being outside it, I think it's easier to kind of actually oversimplify it even more. And just like the first question any healthcare professional should ask is, so what's going on in your life?
Exactly.
That opens the door to all these things. And then I think what's interesting is that there is clearly an increasing level of awareness of the impact of trauma. And in a way that's like right now we're having this really very fast vaccination effort against this virus, right?
Yes.
That kind of awareness is essentially a vaccination against getting as ill as one might if they have that awareness. Because what happens is these things pile on each other. As you said, this woman went to 20 different people, and each one of them wasn't a cure. It was actually just another 80-pound weight on her back holding her down, because she's like, there's something wrong with me. There's something wrong with me. Instead of someone said, you know what, actually, there's something wrong with our entire culture. Yes. It's not an anomaly. This is actually really normal that you will be having these symptoms, but they should be telling you something. And as soon as that happens, if someone's open to it, meaning they've been vaccinated with the idea that this is true, then they're going to be open to it. Then it becomes this vast vaccination campaign that we're having in terms of, that awareness, so that people then don't have to spiral into all these different distractions, and instead take that information and go, now I get it. And it doesn't mean it's going to stop and they're never going to have any symptoms again. It's that, no, now they know how to address it, at least have the tool, begin to have the tools to. And not only that just like in healthcare, you need the frontline workers vaccinated first so they don't get sick. And so they have the means to deal with it.
Yeah. It's about people like Sunita being a frontline worker, able to go now immediately to what's going on in your life. Right. I mean, that was a really opening ability, wasn't it? To just sort of see how her trauma was actually hidden. I love it. I wrote it down.
Yeah. Hidden from View is the name of the book.
Yeah, or Hide Within Us.
But I would like to say that, with my little bit of knowledge about sleep apnea, but just over the years, I always thought that a big, gigantic chunk of it is emotional, because how can a lack of sleep not be anxiety? Or the lack of sleep, even if it was from a physical problem, not cause anxiety. And here we are again, that the person should be treated, not the disease or the symptom, and also that the emotional slice of who we are, the emotional piece of who we are, which is the bigger piece, needs to be addressed when there's any kind of dysfunction or imbalance. Because there's our reaction, our response. Besides, sleep is very emotional and very heartfelt and very soul-like and very scary. Who here was scared of the dark? You know,
We all are. We all are.
Yeah, and I think it's actually a lot worse in this pandemic because we have less distraction of the world and less experiences going on. So I think sleep gets harder for everyone. I've been seeing it a lot in friends. A guy I know a little bit had just posted something about hasn't been able to sleep for weeks. And so my go-to is just breathing exercises. And I tell people, just get out of bed, sit in a chair for 5 minutes and just really focus on your breath. And then you disrupt that pattern of thinking that in that half sleep state that makes you feel insane, and it helps a lot too, you know.
Yeah.
Rose, do you have anything to add? Because I'm going to bring my dental sleep lecture in a little bit so we can clarify and classify sleep disorders.
Yeah.
Lovely. That would be great. But in the meantime, there's some echo going on and your voice is a bit choppy. Michael, have you got any advice to stop
the only
that
thing I could think is,
happening?
are you using the microphone on the computer? Yeah.
Am I think.
Or is the
This is not
microphone
my-
on your? It's not your normal one. See, I think it might have it might be chasing your voice. So each time you speak, it's
Okay.
compressing it, and then.
So let me take something out.
It's sort of choppy. It's the easiest way I could describe it.
Can you hear me now?
Yeah,
No?
that's a little.
Oh yeah,
better.
we can hear
No,
you
that's
fine.
better.
It's just that it's got
Okay,
some.
so I would rather take these out anyway. Can you hear me?
Yeah,
Yeah.
right. Well, then, that's not
wonderful.
changing.
Okay, cool.
But that's not changing it. It's the microphone. It's not changing the headphones, isn't? Because it's not headphones. It's the microphone that changes it. So I don't know if you have the other kind of just like your telephone headphones.
Michael, this might be the best I can do today.
Yeah, that's okay. I'm just
That's
trying to get
better. I think it's better without the headphones.
Yeah.
Is it better?
Yeah.
It's better for me
It
because I
doesn't
feel
change
like
it.
I'm not in a cave anymore.
Good. Fantastic.
Okay.
maybe.
Good. Go
So-
ahead.
Let's talk about sleep. And it makes me sad to hear that people are having such difficulty sleeping in the pandemic, because when I think of the distractions that are no longer here, to me, that's an opportunity to go deeper. So let's see if we can get to that concept. There is something called sleep deficiency. That is when we chronically are not getting enough sleep. Are you hearing an echo?
Yes.
Yeah. How's that?
That sounds a
what
little
have
better.
you done? Good.
A little bit. There's
Well,
no
no,
echo.
but it's compressing it. So maybe take one ear out so you can hear better of what's coming of your voice, and then you'll feel more comfortable speaking. How's that?
It just
Like
looks
when you,
bad.
no, but when
Michael, it's going to start something, okay?
It's choppy still.
she's asked me to help, but I
Yeah.
can't. I don't know what to do.
Let me continue. Should I continue?
Yeah. This is good.
Okay. So there's sleep deficiency, and then there's sleep disorders. Sleep deficiency is when we are not giving sleep the priority. This is a cultural issue where it's just showing off. Oh, I had a project. I just did my preparation all night. Last night I was reading, and about 8:30 I said, if I'm going to be able to say anything of any sense, I better go to sleep. This is new. This is in my household like the last 10 years maybe. Otherwise, I would be like, oh my God, let me just read one more thing. but now I understand differently. The people that have night jobs or hours that are constantly there, their sleep cycles can get disturbed, and that's sleep disorder as well. But sleep disorder breathing is where a dental sleep professional would treat a patient. That is, sleep apnea is when the upper airway repetitively collapses when we sleep. It doesn't happen during the day. If you have sleep apnea, you're going through the day, everything is cool. But at night time, the upper airway collapses. We do not receive the oxygen for an arousal to be recorded as apnea. It has to be 10 seconds or more. That's what an episode of apnea is. Now, you could think that that's not a big deal, but all you have to do is, and I've got a clock here, let's just very quietly sit still for 10 seconds. And if you're willing to do it, not breathe. So we'll start now. That's 11. So you
That's
get
an
a
awful
sense
lot.
of one apnea event. 10 seconds is the smallest amount of time. So an apnea event can go longer. Now let me explain how obstructive sleep apnea is classified. If in 1 hour you have less than 5 of those episodes, you do not have sleep apnea. 5 to 15 is mild. So that's that many times, 10 seconds or more, either not breathing, which is called apnea, or partial breathing, which is called hypopnea. We add them up, and that is an index. 15 to 30 times in 1 hour, just imagine what's happening in the body, is moderate obstructive sleep apnea. And 30 and more is severe. When we are trying to breathe, we're making the effort, but there is no breathing. What happens is that the carbon dioxide goes up, oxygen goes down, and our body gets that alarm. Danger. So we respond. And most of the time we're not awake in the way that you would think. You're not walking around, you don't wake up. And so what the brain does is it activates the sympathetic nervous system. Now let's go back to basics. What happens when you have childhood trauma? It's that sympathetic nervous system, which is again lighting up again and again, regardless of the threat. So you can start to see the parallels here. So we inhale that oxygen, now balance is tilted, and we start. If you have slept next to anybody who has sleep apnea and they've been snoring, you can sometimes see them gasping for breath. And that's the gulping in of oxygen. So this is repeating itself all night long. The sympathetic activation of these arousals is what causes the damage internally to a patient who suffers from sleep apnea.
Mm.
So when a patient has sleep apnea, according to the American Academy of Sleep Medicine and the American Academy of Dental Sleep Medicine, they got together 2 years ago and they made recommendations on how to treat patients who have sleep apnea. Mild, moderate, severe. For severe, first line of treatment is CPAP, continuous pressured air. And that's where you have a mask,
Yeah.
and that will give the patient pressured air. And that airway just opens up.
Wow.
Moderate, there's a difference in whatever comfort level a sleep specialist may have, but many sleep specialists are recommending oral appliance therapy for moderate patients. And mild responds very, very well to oral appliance therapy. Now let's talk about CPAP. CPAP is great. It works every time, if not high 90s. It's like a fire hydrant, putting out a fire.
Yeah.
The problem is that if you look at research, anywhere from 30 to 70% of studies show that patients have a hard time tolerating for a variety of reasons. So even if we're conservative, let's say 1 out of 2 people. So oral appliance therapy is wonderful for mild, moderate. But what about the severe sleep apnea patient who takes the CPAP machine home, tries it? Either they can't tolerate it, or their bed partner can't tolerate it, and they stop treatment. Talking about ACEs, depression, chronic pain, fibromyalgia, all of those conditions that are such an intimate part of your program and of your audience are suffering. Studies are showing that that profile of a patient also is at a higher risk of not being able to tolerate CPAP. A lot of research now being done with armed forces, post-traumatic stress disorder. Many patients cannot tolerate the apparatus.
Mm.
Rape victims, rape survivors, I don't want to say victims, rape survivors may have difficulty. There is a very recent editorial from researchers in Texas. There is a big movement to have a whole different category of sleep disorders that are associated primarily with trauma.
Wow.
So you
Fantastic.
may see this in the future. I think it was just last year that this editorial letter to the editor came out. But that's where dental sleep medicine has so much to offer. This awareness with what oral appliance therapy can achieve for patients who have sleep apnea, a history of trauma, history of ACEs or adult trauma, mental illness, there are so many categories
There
where
are.
oral appliance therapy is not only underused, but is unknown. I want to change that because I am a survivor of ACEs. I'm not a survivor. I'm a thriver. I want millions more of me out there. And without sleep, there is no healing. There's no healing. One thing to really understand as well is that the REM cycle of sleep is called the therapy cycle.
What is it?
It's called
Therapy.
the therapy cycle. It's where there's no noradrenaline secreted by the brain. It's that only time. It's an environment of peace without that hormone, which facilitates healing. A lot of work going on with this. Matthew Walker, Dr. Walker, talks beautifully about it in his book, Why We Sleep, which I believe everybody needs to read and reread. So, what happens when you have sleep apnea? Why is there so much destructive results and exacerbation of a patient's medical conditions that are considered comorbidities? Hypertension, history of stroke, obesity, metabolic syndrome, diabetes, gastric regurgitation. All of these conditions are seen at a much higher level in patients who have sleep apnea and vice versa.
Yeah.
Depression. When we have sleep apnea, it causes sleep fragmentation. It causes intermittent hypoxia. So the oxygen saturation levels suffer. Sympathetic nervous system is hyperactive. The hormones, stress hormones, are cascading, and that's where all the danger is. And the impact of this sympathetic hyperactivity is what causes and heightens the medical issues.
Yeah.
So untreated sleep apnea is deadly. Untreated ACEs is deadly. And we can combine efforts by doing simple things. When we're taking a history of a patient, asking specifically about chronic pain, mental health, and as Michael said, what's going on? How are things? You know, post-pandemic, yes, we're going to get vaccinated, but the debris is going to be for miles on end.
Right.
And we are going to have to proactively ask these questions to our patients. Many times, people haven't quite downloaded to themselves how terrible their childhood was. Because we don't know anything different. You know, if a parent was alcoholic or abusive, verbally, physically, was mentally ill, the environment we grow up in is what we know to be normal. And that's the conscious part. The unconscious part is that the pain of a childhood of adversity is so deep, is so dark, that unless we have someone witness it with us, be there for us, we will have a hard time looking at it from a physiological sense, from an emotional sense, from a psychological sense. And those are the times and those patients that Michael start in your movement. Our choices. I've even been thinking about choices. How does one regulate their behavior when adverse childhood experiences have shown to affect the part of the brain that regulates behavior? So going to sleep on time, sleeping enough, all the factors that make up for a healthy life, nutrition, stress management, exercise, choices. These patients, these children who grow up to be adults, if they're untreated, proper sleep is not at the top of their list, maybe. These patients also have a higher incidence of sleep disorders. I can't explain most of it. And sleep researchers who are doing clinical research are hard pressed to as well. Every study you read is, well, there's evidence for this, there's evidence for this, and you could just go crazy. So I'm going to share my life experience as an ACEs survivor and someone who had sleep issues. And I will take you on this arc and tell you how it changed not only my life, but my family's life, if I may. And I'll keep it very brief in a linear way. Before I sought help for ACEs, and I didn't seek help for ACEs because I didn't even know what ACEs were. I had relational issues. Went into therapy and, just go to the previous session I did with TMS RoundTable. It'll give you a pretty good idea of what I experienced. But I connected 10 years of getting up, not once a week, not twice a week, every night, 2 o'clock, 2:30, racing mind, intrusive thoughts, rumination, queen of rumination. Worst case scenario, and actually, now that I understand it, the physiology of fear and rage. All the rage, it connects to me, Mike. I even now remember waking up, my shoulders would hurt because, again, hindsight, I'm sharing this so somebody could listen to this and seek help. But my fist would be like this, and Rose, you can understand this. My fist would be like this.
Wow.
Tight. We're talking a decade. No idea. And I'd get up in the morning, exhausted, used the fumes of energy, and went out and was a mother, not a really good one on certain days, a wife, a doctor. I gave all of my good energy to everybody but myself. And Michael, I needed back surgery because where was this all going? This doesn't release anywhere. Everything went to my back. And not to repeat that story, that's the other video, but had back surgery. What was going on in my body with this sleep deprivation? I gained weight. I don't think I ate as well as I do today. Harmony in my household, yes, it was good, but it was not so good as well. And I knew I could do better, but I didn't know what was wrong with me. Why is it that I start yelling at my kids? Why is it that I'm tired? And the pressures of life, you know, kids, work, this, that. And little did I know then, everything had to be perfect. You know, the sickness of perfectionism. ISTDP changed that. Getting to the source of my transgenerational pain and trauma that gets perpetuated. I healed, but the healing continues. And now I can look back and put my sleep history together with my pain history, together with my nutritional choices, stress level, and so many other things. So when this patient came in, it's like, okay, why is nobody else talking about it? And then the syndrome. Well, nobody else is talking about it, so maybe it's not worth it. And then I'm like, Huey, you know, what's the worst? That I'm chasing something that doesn't exist? But what if I'm chasing something that needs to be discovered and then brought out?
Exactly.
Yeah.
And I think we are on to something. ACE, sleep, dental medicine, collaborative work. There's not one bullet. There's not one thing that we need to do. It's a circumferential, holistic approach. But it starts with our mind, our mental health, and our heart.
Yeah.
That's where it starts. And resilience. It's so important, resilience. But my model of healthcare is actually a little bit different. I love how sleep is the foundational part of every pillar of wellness. Exercise, choices of nutrition, hobbies, heartfulness, self-love, self-care, all of that. But underneath sleep, or maybe together, I'm still working on that, is love. Love is what we are here for. We are
made of.
to be loved. We are here to love. That's basis. When that connection breaks, you're not connected. The world is different. So sleep and love, you know, I'm not going to quibble here. But those are the foundations.
Yeah, totally. I think someone's phone is going off. There you go.
There's something going on in the background.
So I want to roll back a minute because you were talking a moment ago about all these different causes, and all these different connections. And I think there's a few really important things to think about. One is that all of our experiences and what we would call our adverse childhood effects are profoundly relative. You might have two children in the same family,
yes,
where one is profoundly affected by the screaming and one is affected, but not in the same way.
Yes.
And so as we approach all these things, we just have to think that everything's really relative. They're also really cultural. And that doesn't mean just within the culture of our families, but in the larger culture of our culture in the moment. And I think what's interesting is that we're having kind of this mashup of both really profoundly higher levels of awareness of trauma, which conversely is leading to a lot of other attendant traumas that are being created by the rising of those traumas. Just like your patient, she needed to know about the trauma, but it actually became overwhelming. And I fear that at this moment in our culture, that's kind of where we're at. And I'm talking about that from that cultural perspective in terms of race and gender issues, where those things have been repressed for so long that as they come out, there's the expression of them become healing, but they also become problematic because we become actually siloed in a way in our own experiences, saying, we must center my experience because my experience is so traumatic. And while that's important, it also actually is almost like dropping little bombs that push people away from us. So even as we're trying to, and it may attract other people who have had the same trauma to us, and then we actually become a bigger bomb that's affecting other people. So we're starting to have all these tribes and all these things, and we're becoming more aware and actually more reactive at the same time. Because we have awareness, we say, okay, this reaction is justified, without realizing how much that's pushing people away from us and how much conflict that's creating in our lives. I mean, you can see that on Twitter just all the time. The tribes come together and they feel like it's productive to bond in that way, but it also pushes people away from them. So it's just a really complex moment that we're at. And it's not, none of that's being said with it. Well, I'm not trying to say it with judgment. I'm just saying it with awareness of how then with that awareness, how we then, we approach that with empathy rather than reactivity. And then even in terms of, say, even in the medical world, as say someone like yourself comes to that awareness, it's like we want everyone to be aware right away. And in sometimes that energy actually pushes people away. And I say that like from the point of view of when we first put out the movie, I could get a little frustrated with just how much resistance there was. And so I learned to never offer the movie to anybody with any expectation, to explain it in any way. Here, this might help. Because that expectation creates resistance. And so it's this really weird balancing act of being like, so say a patient comes in, you're aware of it. The thing that's really hard is not to tell, but to draw it out. Like not to say, so you walked in, I saw you've got this, like, it's like you're carrying 40-pound bags of potatoes on each shoulder. What the hell is wrong with you? It's to ask the question like, wow, so what's heavy? What's going on? And then inviting them, not forcing them, but inviting them to open up a little bit, because you can't pull it out of people. And that's the other, but at the same time, as it becomes more culturally acceptable to have a problem that's emotional, the more we're able to share it. The point is, just like with the science, so you were talking about, well, it all depends because the science is unclear. Because the science is nonsense, honestly. All the science that we do, so much of it's nonsense when it has anything to do with the emotions, because it's not trackable or traceable in the way that we want. Like, say, here, take this drug. How's it affecting that? If you can't, it doesn't fit in that kind of context. And so it's really important to just not even try too hard. I mean, most of the studies that are being done are just to prove it to other scientists, rather than just go, well, hell yeah, that's goddamn obvious. It's like, of course.
That's a brilliant point, Michael.
Yeah.
It's something that has been addressed very sensitively.
Yeah.
By Dr. Nadine Harrisburg. She really put ACEs on the map in a big way with her TED Talk.
Yeah.
But in one of her interviews, she mentioned that sometimes you just want to give the ACEs score, it's 10 questions, to someone, and don't ask them which ones apply. Just, if they're ready, have them tell you how many. apply.
Mm-hmm.
In our practice, and also know that we're developing this. You know, this article just came out in Dental Sleep Practice, to whom I'm very grateful that they gave me the opportunity, and in particular to their editor-in-chief, Jason Tierney. Without his vision, this couldn't have happened. But if you were a patient in my practice, Michael, and you came in with the gorilla on your back, the conversation would be something like this. Hi, Michael. We got your prescription. I see your diagnosis of sleep apnea here. Let's go over your medical and social history. Tell me a little bit about when you noticed this issue. Was it your bed partner? Was it you? Tell me about your disabilities with this. And let's review your medical history. So we go over that. Part of my medical history is your mental health. And I ask you about that just like every other question. Okay, so how's your mental health? How do you feel emotionally right now? Anything going on? When I see fibromyalgia, back pain, history of, microdiscectomy, fusion, cervical surgery, I need to have some entry point.
Mm-hmm.
And at that point, I sit down and it is a conversation. And I won't say, you have ACEs, because I don't know. I have no idea.
Mm-hmm.
I'll go over many times patients who have this profile may have blah, blah, blah. Listen to the patient through their body language.
Mm-hmm.
Just because we have information and we can share it doesn't mean someone's ready to hear it.
Right.
Doesn't mean someone's ready to heal.
Right.
I knew a lot, but only when many factors that I understand and many I may never understand did I go to get help. So that's a whole other very complex system of the unconscious, the conscious. Where are we in our life? That's not my pay grade. And neither do I want to push a patient where I'm breaking that connection, because maybe that conversation is all for that visit.
Right.
And as time goes, maybe we can further it, or the patient may ask. So it is, as much as I would like to say, well, it's boom, boom, boom. No, it's not like that. We still have to have tremendous sensitivity and create systems that make a patient feel comfortable. But on the other hand, I am impatient. The tipping point for ACEs is here. In a few months, I think it's end of April, Dr. Bruce Perry and Oprah are releasing their book that they've worked on together. And we have to ask someone not what's wrong with them, but what happened to you.
Yeah.
And leave it there. And society has changed. In the last 5 years, you see ACEs, it doesn't have to be explained anymore.
Right.
We know it.
That's the vaccination.
Yeah. Yes. So a sense of urgency to bring this information out. Collaborations, aggressive approaches to fellow practitioners.
Right.
Can I
sensitivity.
yeah. Sunita,
Yes.
this wonderful article that you wrote, which I have here, let me show our viewers. Tell me about the feedback you've got from your colleagues. I think that our audience would like to know how open they were, because in my experience as a registered nurse and midwife and mental health nurse, each time I've done a talk about this problem, people are very interested, and that's very nice. But nobody asks me afterwards about what they can do about it for the patient. And I find that quite intriguing, that people will just go on their same old system without asking any questions. So how long is it since this was published? 2 months ago now, or a month and a half ago.
Yes.
Have you had any feedback?
Well, some of the feedback is kind of what you have, silence.
Tragic, isn't it? Yeah.
But there has been quite a lot of feedback from people who may not even want their name mentioned. It's still not a sexy topic. It's just the way it is. Childhood trauma is ugly. It's painful. It is part of our society. We want to forget about it.
It was in the past. And behind closed doors.
If we say, oh, it happens in Australia or Israel, down the road, not here. So the response has been mixed. It's also been very little time. However, I see it growing in the emails that I receive, the texts I receive, the invitation to come speak here is a part of the change. So I'm very encouraged. And
fantastic.
I was surprised when I was able to publish this article, because I was actually going to write an article on insomnia and sleep apnea, which can occur, together. And I was talking about this particular case to the editor, and he was listening. After a while, he said, write about this. I'm like,
okay.
I don't know. It's all up in my head. So I have to say, I'm really proud that I pulled all this. He was a great help. And together we pushed for an article that was like about almost 2,000 words more than the limit. So kudos to Dental Sleep Practice and Lisa, who's the publisher, for giving it that space. From here, I hope that the conversation grows, because yes, there's power in what? The miracle is when it grows.
Sunita, you haven't even mentioned, which, I'm more familiar with, but it's everywhere. I mean, you have not mentioned TMJ. You've not mentioned jaw pain. You've not mentioned sinus pressure.
Headaches.
You've not mentioned headaches. You've not mentioned all the facial. We're talking about all the cranial nerves, and everything's happening up here. This is Grand Central Station back here under my neck, which is under my jaw, and my remember the stylus, you get that mandibular
mandibular.
I mean, we've got enormous amounts of action happening here. Stress. I think, I feel, I eat, I smell, I hear. This is it. And this is the teeth. I mean, everything has a mental and emotional component. And I think that's even a bigger place. I have a colleague who is a dentist and he does surgery and all sorts of stuff. And, he might do some body work on people and it relieves dental pain. It's just, he works on their feet or knees and it creates blood circulation. One, hand's connected to the other hand and people feel better.
It's all about the airway. In my practice, in my dental practice, there's a big shift. Patients used to come in for TMJ, tempomandibular issues, pain, muscle pain, worn teeth, and we would make them a mouth guard. I don't make mouth guards anymore.
Wow.
First, you're going to get a sleep study, a sleep consultation with a board-certified sleep specialist. And we're going to rule out obstructive sleep apnea. And only then will we make a mouth guard or for bruxism. And the design of that has changed too, to prevent the mandible from slipping back during sleep. So everything has changed with having the airway front and center.
Well, also, I'm going to disagree with you because we didn't have TMJ issues in our parents' culture. It was probably not even an issue. Nobody was making mouth guards for grinding. Our parents didn't grind, Rose.
They just act us.
Oh, well,
I think they probably did grind their teeth. They just were like, fuck it, there's nothing I can do about it.
Tovah, you should go on night duty and hear it.
Yeah. They were grinding. They just didn't did anything about it.
Yeah, exactly.
I think Rose got that.
And why? I have to ask a personal question to a dentist.
Yes.
I've been in Israel 12 years. So when I was in America, why was it that the dentist would have the highest rate of suicide? Do you remember hearing that in America?
Given that up to vets.
Okay. To veterinarians?
Yes, actually, female vets. Don't quote me on this.
Yeah.
Twitter feed on this, but no, it's. I actually
why dentists? Why dentists? Why of all fields?
I don't know.
I don't know. I didn't mean to bring it up. I didn't mean to cause stress.
I've heard that as well, but I don't know. I've really enjoyed my career. It is, like anything else that's minute and, it's a business, so there's stress. But I think my stress was coming from unacknowledged childhood trauma.
Right.
My resilience has gone from here to here.
Yeah.
And it's not a matter of, I just want to survive. No. That's the goal. The goal is transformation.
Right.
The goal is resilience, joy, and relationships. So that's the whole motive for me to be here. If there's no sleep, there's no life.
Wow. Yeah.
Yeah. Well, that's what you said there.
Yeah.
Sleep is essential.
So it is when we heal.
Our best life.
It is when we heal. Sleep is when we heal.
Yes. In more ways
the
than
body
one.
heals.
In more ways than one.
Yeah.
We heal, we create, we dream, we imagine. The brain is so busy when we're sleeping. Different stages have different functions. And it's incredible. It's such a gift. But there has to be a cultural change.
Mm-hmm.
If I don't want to live my best life and my best love, then why do I care about my sleep? If I don't feel that I'm loved, then where are the stakes to sleep and wake up in a optimal state?
Refreshed.
Yes, ready for the day to give my best to the world. So it has to be a culture change. And it is an act, it is the biggest act of self-love, self-care to sleep.
It's true.
Right. And you're making me think, though, that as much as like your article is important within your field, but really I think what we need as much as anything else is cross-field conversations. And the problem is that everyone gets so cloistered, though, and it's really difficult. I can't tell you how many times I've tried to connect one doctor to another doctor in another field, and they'll send the email and then it just goes like that. So as a strange coincidence, I recently posted a picture of a guy I knew in college, and I didn't have any connection with him. Someone reconnected me to him, and it turns out he is Dr. Burke Harris's right-hand person now.
Oh, wonderful.
Yeah, is Eddie Mochtinger, and he's a doctor at this San Francisco clinic. So it's just how small the world is. But like, I tried to connect him with Dr. Clark and Dr. Schubner and all these people, but it just goes.
By the way, I sent all the article. They don't probably crazy.
No, I think they
everyone's interested in seeing it from different points of view, but it is difficult for them to figure out how to work together. Like there's that book, How Healing Works, which I think is an amazing book. And I've made so many efforts to connect that guy to the other guys, but instead they just go through their own fields and they go speak at hospitals and everyone ignores them because they're not ready for it. So they really all need to be connected, because when you connect all the different fields, then you get something going and you make the connections. Oh, we're being overly specific about, the gut biome without understanding how much the brain biome is affecting the gut biome, because we're so focused. And so we need these people to be talking to each other. And it's again, cultural, the culture of the way our systems work. It's really difficult for these people to work together. It's crazy.
Well, we could blame the cards for that, can't we?
Who can we blame?
In your dualism.
Yes, exactly. Descartes. Yeah, totally. Yeah, everything is either or rather than yes and. Right. It's why we always need to say, instead of saying like, in improv comedy, you don't say no but, you say yes and, because you're continuing a conversation. It's not no, so it's yes and is so much more valuable. But yes and has to actually really be listening, because sometimes yes and is really a no but in disguise.
In disguise. Yeah, it is.
I love it. What about your jaw pain, Michael Galinsky?
I don't have any jaw pain, no. I'm pretty lucky that way.
Since I adjusted your neck last September in Israel. It's working.
It's working. That was actually 2 years ago.
2 years ago. Yeah.
I don't know.
Yeah, 2020 sort of gone out the door, hasn't it? And
thank God.
Well, Sunita, this is amazing.
Look at this connection. We wouldn't have made this connection without all that trauma.
No. What a blessing.
Amazing.
Thank God for trauma.
We have such an opportunity in this world, in this society right now, for transformation.
Yeah.
It's just incredible opportunity. I feel like it's just, the air is fertile with the opportunity.
Yeah.
And without sleep, it's not happening. So sleep. I'll tell you a funny story.
Without exercise, it's not happening. Without air, it's not happening. Without seeing all the rest, it's not happening.
Don't get injured. When you're sleeping well, you have a better workout. So you're better focused.
Of course.
It's just so much better.
Of course.
But the way that my house has worked for a long time is that come 8:30, 9 o'clock, I'm shutting everything down. My friends told not to call me after 8:39. But we had a dog who sadly passed away last year. And everybody would get a kick out of me telling him, 4, it's time for bed. And he would walk up the stairs. So even our pets are trained to go to bed on time. And that's the cultural change that we need to have to thrive. But everybody's coming at their own speed and for their own reasons and their own motivations.
Excellent.
You should do an article on shift workers.
Oh yeah.
One more article, my husband will make me a shift worker.
I would like to, for the cause of how many hours we need. I think it's an art. I don't think it's for everyone. I think it's sleeping. How many hours people need is an art and not a science.
There's a lot of science now. 7 to 8 hours is where the number is. There's a very small percentage of people that need less than that, much smaller than most people think, that percentage. But 7 to 8 for an average. But you're right, Tovah, there are some nuances, you know.
Yeah.
There are nuances. We have our internal systems. Some people are larks, some people are owls. And age-wise, you know, how the needs change. So sleep is a fascinating.
Well, it is. And I just know that if it's like it's a very emotional mental law of attraction. If I don't get a certain amount of sleep, I'm going to be stressed. I just don't want to go there for myself. I remember my daughter having an issue with it, and we'd be talking about, but we're creating the stress from just talking about it.
Yes, that's very common as well. That's part of what they deal with in CBTI for insomnia. Is a patient's preoccupation with their sleep or their lack thereof. A shout out for CBTI. I know insomnia is a very problem, and many patients get prescriptions for them. But the first line of treatment is CBTI, cognitive behavior therapy for insomnia, which is a limited amount of sessions. It could be 8, it could be 12, where a specially trained therapist is going to address all of this with the patient.
Wow.
And their mental preoccupation or even rumination about sleep is definitely something they deal with.
Like ruminate about it all the time.
Yes, it becomes stressful. I know the feeling. 2 o'clock, what do you think I used to do when I get up? I'm like, oh my gosh, now I can't sleep. Now tomorrow I'm going to be tired. I can't, it's horrible cycle.
Right.
Horrible. And at that point, I didn't know that I needed an oral appliance as well. So snoring, those people who are snoring out there, just, get yourself to a sleep center, get a sleep consult. I would like to make sure that we have a few minutes for an action plan for anybody who feels that they have sleep issues, like what to do.
I want to help people that are snoring. I feel like I want to find a resolution for snoring.
Pillow over there.
I know, not that. I want it.
There's the resolution.
I want to find out. Like it's
okay. It's smooth muscle anxiety.
Okay.
Where the smooth muscle collapses when you're lying down.
So you can use
snoring is not benign. Snoring is not benign. It is a continuum that can go and progress to OSA, obstructive sleep apnea. It is also very detrimental to the bed partner. Mayo Clinic has done studies. There are other studies that are coming out. Conclusively, the bed partner of the snorer suffers the same kind of symptoms and deprivation. Their sleep fragmentation is also damaging them.
Wow.
So the relationship, people sleeping in different rooms.
Yeah.
Sunita, do you think the bed partner is also snoring though?
Could be. I have many patients that come in and they're like, I'm not snoring, but I'm sending my wife, or I'm sending, because I can't sleep anymore.
Because why I asked that question is, why is it that some people can ignore another person's snoring because they sleep soundly, and another person hears the snoring, so obviously they're activated in some way. And I'm thinking that the REM sleep and the different sleep cycles are not deep enough for the partner. And I often wonder if it's the partner that needs the help as well.
It's common among partners, depression and mood irritability. And then there's the fights. It's not good.
And
Not
what's
good.
sad is that so many people are taking sleeping pills, so they're never
Yes.
going to get back to a normal cycle. And then we're talking about the pharmaceutical companies, which don't get me started. It's very sad.
The saddest thing is that these sleeping pills over, period of time are showing not much difference than placebo. Patients
Wow.
that are having, heavy users, 132 pills a year, have 5.3 more times the likelihood of death, early death.
Hmm. Well,
Cancer.
then maybe we should get them on placebos right away.
Right.
Yeah. Plus, that would be great. But
Okay,
there's a worldwide shortage of CBTI therapists. So, the whole system is not perfect.
Yeah.
I mean, CBT for insomnia.
Yes.
Why couldn't we use ISTDP or TMS therapy on insomnia? It's all about stress, no?
Well,
Unless it's something, unless it's part of it,
stress
the part of it that's physical. I understand.
stress is there, but these therapists are focusing on, first of all, they're going to ask the patient, what is their sleep patterns? What is their life pattern? So if I am up at 2:30 till say 4:30, or maybe straight through go to work, what's going to happen when I get back home is that I'm going to be exhausted. I may take a nap at work. I may take a nap from like 5 or 6 in the evening, get up, have dinner. Now there are 2 sleep cycles. Without getting too specific, the S cycle is the one that when we wake up, we have to start building our need for sleep. But now if we're taking multiple naps because we're exhausted, here's sleep time. And that account has already been withdrawn. So now we go to bed and the pattern continues. So their job is very tailored to see all of your daytime habits, your emotional and mental connection to the sleep problem, and really tailoring your approach to sleep in a much more professional way than I'm describing it. I'm just giving you the gist of it. So CBTI is a very focused therapy. And it's very successful, 60% or so success rate. That's amazing.
Listen, this is a big topic. Insomnia and sleep, it's a very important topic.
Yes.
Right, Rose?
Yeah.
Important. Yeah. So, Sunita, we're going to have you come every 50 shows. You're going to come on. Michael comes on every 10 shows, and it's never enough. We love having Michael, and Rose and I are here all the time. So it's wonderful information. If anybody wants the article, I'd like to post the article again, which I'll do. We're even going to have a watch party with this YouTube and have people join us and hear your really so informative. You know your stuff. You express it very well. I love hearing you, and we'll see you in Jerusalem.
God willing.
In the meantime, I'm glad that you're well. And Michael, love you, bro. We'll talk soon. Rose, I'll see you in the morning. I'm going to go to sleep.
Tovah, could I just have a moment before you finish?
Please.
Yeah. Sunita has a poem for us.
Oh,
please.
yes. I'm so happy you remembered. Yes.
I'm not going to forget those things.
Yes.
Sunita, she has one about sleep, and it's so beautiful.
Do you have a copy of your book? Do you have a copy of the book with you, Rose?
Oh, no, it's on my bookcase. I forgot to put it,
okay.
but I'll put it down afterwards.
Yeah.
Sunita, can you put those few words out for our audience, please?
I actually turned my phone off. I don't have the phone. Do you have it there?
Yeah. It's the first thing I read when I woke up this morning, and I thought, awesome.
Well, you read it. Rose. I would be
will.
so honored.
Haunted. There are no promises to be made. There are no promises to be made for the times that have not yet unfolded. And when I reflected on that this morning, I thought, how amazing. That's my little bit. So sleep, my love. Anita, yeah. And you know, when we wake up in the morning, we don't know how the day is going to unfold.
Yes.
But the importance about it is accepting it. And once we accept it, we can find a way out or a way in. But at the moment, it's about accepting it and rejoicing. And Sunita was talking about love before, and I want to end our program today about love, that we need love within ourselves first. And that radiance comes out and touches everyone like the sunrise. So when we go to sleep knowing that the sun is going to rise, please God, and that radiance is going to encompass us all. Even behind the clouds, the sun is still shining. God bless you all.
Thanks for the virtual hug. Good night, good afternoon, good morning, everybody. We'll see you next week. Thank you so much, Sunita and Michael.
Thank you.
Love you both. Bye-bye.